Hi and welcome. We're all about educating women, empowering wellness, guaranteed to grow your patient base and your ROI. So today, not only about sexual health and hormones, but we have an amazing speaker, and I'm very proud to have her here with us again. And our guest is Susan Murrmann. Susan Murrmann is a board certified gynecologist in Tennessee. She's also aesthetically trained and teaches globally. She just finished functional medicine and anti-aging certifications, so she's very well-rounded. Not only does she have a successful gynecology practice, but she also has an aesthetic center. So that's one of the reasons why we have her on tonight, to really talk to you about how to expand. So she's the co-founder of Murrmann Center for Wellness and Health 360. And she also has a Murrmann Center for Laser and Aesthetics. She's the co-founder of multiple things, and they've just now gotten into body as well as face and everything beauty. She's the author of many articles, and soon, hopefully, we can get her to do a book. That would be my favorite thing to do. But the new year is fast approaching. And so we want to talk about updating your menu. Since we have 80 to 90% women in our databases for Medi-Spa practices, we want to update the menu, add new profit centers, and be more proactive with the women that we have. So in the frank discussion that we have tonight with Dr. Murrmann, and we do have a happy hour, so when she comes on, we'll make a toast. But we're here for Susan to share her pearls on empowering your practice. And so, Susan, welcome.
Welcome. And here's to happy hour.
Happy hour. Absolutely. We can use happy hours. It's 5 o'clock somewhere all the time, right?
Yes. Well, it's good to be here, and it's good to see you again. I missed you.
Wow.
Haven't seen you in person for what, a year now?
I don't even know. Yeah.
I know. But I'm always inspired being around you. So thank you for having me.
Oh, you are so welcome. And you inspire me. And you have so many things that like rule the world and rule the women. And, you know, you are empowering women every single day with sexual health and with hormones and with consults to look more beautiful. And so I kind of wanted you to share some of your key pearls in how do you empower within your practice. And then there's also that cross promotion, because you have a gynecology practice and right next door you have your laser aesthetic center. So you have a lot going on, and I know that you're very hands-on and very involved. So I guess we can talk about empowering your practice and how do you get women engaged in all of your aesthetics and your women's sexual health programs?
Well, I think it's really easy now, and I know that you've included a handout on that article that I wrote, 50 Shades of the Graying Vagina, which I actually do credit 50 Shades of Gray for really bringing sex and women and desire, hormones and whatever to the forefront. And that, you know, first it was Sex in the City, and then it was 50 Shades of Gray. And those two things really made it easier to talk about to your patients when it comes to sex, and for them to have a better understanding and be not afraid to ask questions. So I credit those two, and it's just been it kind of easy. And then to me, it's always flowed easily into aesthetics, because if you're feeling good about yourself, feeling good about your relationships, you're hormonally balanced, you want to look good too. So it all kind of goes hand in hand, and we've done a really good at co-marketing both clinics together.
And it's interesting because you have on one side the GYN, one side your aesthetic clinic. So both, from what I understand, and one day I'm going to come visit, so both sides are doing promotions for each other. So you're cross promoting. So how does that work?
Well, it's great. You have to first, number one, train your staff to know both sides and educate them on how, you know, hormonal changes go along with skin changes and moods, and how diet and exercise can actually, I'm sorry, I forgot to put my dog up. But anyway,
It's okay.
How diet and exercise really feed into your overall health when it comes to your skin changes. And so Then we've added, our newest thing was the Body Contouring Center,
Right.
which really addresses a lot of changes that we go on, minimally invasive and with non-invasive therapies to make them look better. Because with menopause and all the changes that go along with menopause, what ends up happening is the body changes, and women want to change that as well. And that really figures into how you feel about yourself.
Yeah, and I mean, the self-esteem and self-confidence. I mean, I'm sure you help so many women to feel
Right.
so much better about themselves. And when you do a consult, you're doing it on the GYN side, even if it's a cosmetic patient. How much time do you usually spend with them?
I'm probably guilty of spending a little too much time with my patients because, one thing leads to another, and they're always coming in and asking about aesthetics. So it gives me the opportunity to what we call our 360 approach for our patients, which is, addressing their skin, their concerns about their body, to their overall health and how they feel. So that's kind of how that opens up. And so it's a no brainer. And then plus we have the Laser and Aesthetic Center. I mean, not only next door, but a door connecting the two clinics. So the doors are connecting both clinics. And then what ends up happening too is I have in my office. So while they're waiting for me to see me, they see all these pamphlets and these informational brochures on what we offer on the other side. So they're always picking them up, reading them, and then they have a million questions by the time I get in there.
And right now, are you doing virtual consults, or everybody in Tennessee is out and about and coming into the practice?
Well, we are doing some virtual consults, but then like what I've found totally fascinating is the gynecologist is actually very popular right now because they are dying to get out of their houses. They actually dress up, they put on makeup, they come to see me. They'd rather see somebody in person because I'm their only entertainment so far.
Well, you're good entertainment. I know that, that's for sure. And so they're getting dressed up to come see you. That's interesting. Have you thought about doing any events virtually, or any other virtual fundraisers or holiday events?
We do have a virtual kind of open house for the Aesthetic Center coming up in January. I personally would rather do it in person, and limit it. We did actually, for the new equipment we recently purchased, we had people come to the office in the area of our office to do live demonstrations of some body sculpting equipment. So that worked out very well. We socially distanced, everybody wore a mask. It was very clean. It wasn't people crowded together. And it was a lot of fun. It was a lot of fun, and people got a lot of information. And again, I think they're just dying to get out and see other people. So we had a good turnout.
That's great. That's great to hear. And did you audio or videotape it as well?
We did Facebook Live with it
Okay.
at the time that it was going on. And so that was great.
So
I think
that's
Instagram,
yeah.
we did Instagram Live too.
Okay, great. So that's perfect. So you really did a cross promotion, and then
Right.
you did it live as well as in person. And I've been talking about staging events, just like what you're talking about. And I think that's great. So you really have patients of all ages. So I call it generation X, Y, Z, boomers. I mean, there's so many
Right.
generations now. I don't even know what generation we're in, but there's the whole life cycle of the patient. You're lucky enough in your practice to see young women when they're starting out, then the mommy makeover age, and the pre and post menopause age. So you really get to see the whole life cycle of the patient, where not every practice is a GYN practice. There's a lot of internal medicine, as we know. There's a lot of plastics and derms involved in the aesthetic clinics right now. So wondering, any, I guess, words of advice that you have for them if they're not really seeing a patient for GYN, but they want to offer maybe some sexual wellness and some other services that you'll tell us about?
So are you talking about like internal medicine or other than GYN, or?
Other than GYN, out of your box of GYN, where you're lucky enough to have 100% women, and you are lucky enough to be able to have that one-on-one bond and relationship that you've built over time. So I'm thinking about, how does somebody establish a life cycle and a bond with a patient the way that you have developed?
Well, I am very fortunate that I've seen women from their teens until they're actually, go through childbirth, or they're married, childbirth, and then they end up menopausal. And I've seen them for such a long time. But I think other specialties have that opportunity as well, but they have to have something to offer all those patients. And to tell you what we're doing right now is my patients that I've seen through their entire life cycles, they're married, and their husbands are going through the same exact scenario as they are with hormones. And we have a brilliant nurse practitioner that we hired that treats men. So we're seeing men for hormonal issues right now. So what we're doing, we haven't opened it up to the public, but what we're seeing is the partners of my patients. And so we're treating them together. And I think they appreciate that. And they're going over to the aesthetic clinic as well together. So, because we do a lot of, services for men over in the aesthetic clinic. So now this has really become, totally 360 when we're taking care of the other sex, which most gynecologists wouldn't even think of doing that.
No, that's true. I mean, I was once in a gynecologist office and they were offering, testing for men. And I said, wow, this is so strange. That was about 10 years ago, whether it was osteoporosis or whatever it was.
Right.
And I thought that was really interesting. So it's great that you've integrated both in your aesthetic center and dealing with the women. I mean, they're probably complaining about their husbands to you.
Yeah. Well, I tell them, I don't like to match their hormones unless their husband's hormones are matched as well. So I might as well take care of that.
So you're making a lot of couples very happy, which is great. What are the top, aesthetic services that are requested right now in your area?
Just going by what's happening in our group, non-invasive body contouring is huge. And then also, of course, you've always got the Botox and filler staple business that you get, because that's good. Everybody wants non-invasive. Threading is starting to take off, and we're going to be doing threading in our office right now. So that's minimally invasive facelifts that are going to be great. So that's coming on. And plus we, like I said, we have the new body contouring equipment and body contouring center, which we've hired an esthetician to run.
That's great. How much time of your day do you allocate to the aesthetic center? Because I know you spend a lot of time in the GYN business.
Well, I do the minimally invasive body contouring. We do liposuction, we do fat grafting. And so I'm just doing that one day a week. And so we have some brilliant nurses and estheticians in our practice that are very good at doing fillers and Botox and some of the non-invasive procedures. We're doing a lot of microneedling, which is great, but I trust them to do that job, and I kind of stick to the more minimally invasive.
Well, lipo is considered minimally invasive. I guess it depends on how much.
Not a big incision.
I guess it depends on how much you're really taking out.
That's true.
And how much you're contouring the body. But the body center that you just, launched, I think is great. And that will bring you more lipo patients. And that also, that also ties into, and I know you are involved in everything from intermittent fasting to weight loss to eating healthy. So I think it's a good mix to blend the two together. And do you find that people are asking about diet and nutrition more now than they were in the past?
They are. And it's a hard sell sometimes because everybody wants a quick fix. Either want liposuction, take the fat out, or they want to get a diet pill, which I don't recommend because diet pills normally are temporary. But we do, I've become, good thing about this pandemic, I'm certified in a lot of things right now. And I'm certified in peptide therapy, and there are peptides that are out there that are good for weight loss. But medication is not a cure-all. It does take lifestyle changes. It takes lifestyle changes if you want to keep your body contouring up from liposuction. So I'm big on intermittent fasting, on fasting mimicking as well. I'm a big believer in the Prolon fasting mimicking diet, which we have at our office. It's a beautiful jumpstart to everyone that wants to lose weight, but doesn't know how to go about it, but wants to get that big push and learn how to actually eat. Because as you age every decade you have to change it up. You can't be doing the same thing. You know, it's tough, but you have to change.
Absolutely. You have to change your eating habits. People talk all the time, oh, I'm working out more. Why aren't I losing weight? But a lot of it is based on the food and the intake of the food and the type of foods and the processed foods that you're eating. And you and I have had multiple discussions about that, but we're on the same page as far as eating clean and plant-based,
Right.
and eating healthy.
Yes.
So you have, let's say, a GYN patient that comes in that's extremely overweight. So do you talk to them right then and there about diet and nutrition and send them over then and cross promote them to your aesthetic center?
Well, I mean, you know, I don't, if we have liposuction has a body mass index limit. It's dangerous if somebody's very overweight to take out all that fat at one sitting. But you have to sit there and talk about, and really most of those that are very, very obese will have markers of inflammation in their body, and they'll actually have a pre-diabetes state. So I recommend peptides and nutritional counseling first. Now, if they get down to a body weight where we can do the liposuction, that's great. But then the body sculpting, you know, you can sculpt your body all you want, but you're not going to see those muscles if you've got that big layer of fat. So, you know, you have to look and ask the patient their lifestyle, where are they eating? And if they're in the line for Chick-fil-A every day, that's not a good thing.
No, it's definitely not a good thing. But, you know, I guess in Tennessee where you are, it's also probably a little bit of a, you know, I guess, competitive market, because most people are eating poorly. And then here you're trying to tell them to eat healthy. And then they're walking outside and there's, I guess, I'm assuming fried chicken and fried foods that are not that healthy for them. So it's a challenge. I mean, it's definitely an ongoing challenge.
Right. I think, you know, it's people don't have much time these days. They're running around with their kids when there wasn't a pandemic. They're running around with their kids and they're going to fast food, trying to get something in to eat and then feed their kids because they're always on the run. Actually, the pandemic has been very good for that. It's taught people when they have to stay home, well, maybe I should cook. So a lot of people started cooking. And I think I've seen a lot of patients that have just lost weight when they, during this pandemic, which was great. Some have gained weight, but you know, they're exercising more. I mean, I have neighbors I've never seen before because they're out walking.
Well, people are getting bored, so they're out there, which is really good.
Bicycle.
Yeah, no, I mean, a lot of people have gained, they talk about like the COVID-10, the COVID-20, a lot of people. And now I think after the summer, people are saying, okay, this is going to be going on for a little while more. I really need to get my act together and get in shape. And I spoke to a few people recently who actually told me that, like, now it's time for me to really start looking at diet and nutrition and analyzing what I'm eating. Because at the beginning, listen, we're all stressed. You know, you and I might have more willpower than the average person, but the truth is that it's not easy. It's not easy at all. So your nurses you have 3 nurses and 2 estheticians in your aesthetic center, and they do most of what you're talking about when it comes to the counseling.
Well, when it comes to injections, facial treatments, microneedling, Botox, and things like that, that's their main forte over there. Mm-hmm. Both sides, physicians, we have 3 physicians on our side, and 1, 2, 3, maybe 4 nurse practitioners on our side that are all trained to counsel patients, not only on just diet and exercise, but hormones, but then how to cross over to the other side. So both sides are trained to kind of treat the patient, you know, 360. And I think so our staff has been great about that too.
Well, I think the staff, as you keep, you know, talking about it, and the staff training, you understand how important that is. There's a lot of practices who are just happy to lay people off because they want to save money, or hire somebody at the front desk who's really not that great. But training is consistent. I mean, it's almost like a meeting every week or every month, and keeping up with training. That's one of the reasons I wrote the Beautifully Profitable books, is people can open it up, they can take it, and they can use it for marketing meetings. So everybody gets involved. You have to involve all of the staff. And in your case, you have staff on both ends. Do you have any staff that cross over from one side to the other?
We have a couple of them. One, our body contouring specialist does, and then we have our feminine wellness specialist, and she does as well too.
What does she do when it comes to feminine wellness? What's her main job?
Well, she number one, she manages a lot of the hormones. She manages a lot of Thermiva, which is a radio frequency vaginal rejuvenation. We have Emcella now, which is for incontinence. And that's been great. It's been a game changer for a lot of women that have incontinence and don't want surgery. And then she's also in charge of our supplements. But besides Thermiva, we also have VFit, which I call it a pandemic-proof vaginal rejuvenation, because you can buy it and take it home and use it yourself, you know.
I mean, the home maintenance for everything from skincare to vaginal care to wellness is becoming a huge market, especially now, like you're saying, people who don't want to go out or people who don't want to come in, they could maintain some things at home. Right. And I think that that's important. And that is a huge growing market right now. And I know you have a big retail business as well, where your retail, I guess, tell us what you retail, because it's probably expanded.
Yeah, we have retail on both sides. Of course, you know, it's a natural for the aesthetic clinic because they're all cash only anyway. But what we do have cash only services on the GYN side. So it's very important, number one, to have a separate account and create a cash-based business. But it has supplements. It has all the procedures that we're doing, which was Emcella, Thermiva, the VFit. We have a huge variety of supplements that work, that are great, that are medical grade. So all that feeds into, plus some of the non-invasive body contouring, all feeds into that separate account, which we call Beautiful Medicine.
Okay, so you set up a separate business account overall.
Right.
Just so you could be able to set that up for your CPA and for your bookkeeping. Right. And I don't know if obviously with your partners and so forth. That's a smart move to do that. Because retail can be a huge part of the business that a lot of people are missing that mark.
Yeah, I think they are too. And it's, you know, something that I've always had in the back of my mind, and we've just really perfected it, but we keep adding more services to that area. So,
which is great. So you're adding more and more retail products. Yeah, which is terrific. So, I mean, it could be anywhere from 10% to 30% of income that a lot of practices just miss that mark. But the merchandising and the displays and the lighting, I mean, there's a lot that's involved, and then obviously training the staff as well. So when talking about retail overall, do you offer any kind of incentive to the staff when it comes to the retail?
We have been in the past. They all get of course, they get a marked down price if they want any of the services that are involved. So basically they're getting things at cost. So that's their incentive. And then if they're referring patients from one clinic to the other, we're thinking about adding another incentive for that as well.
Well, that's great. Well, as we all know that, you know, incentives motivate people. And so I know that you're a smart businesswoman and also a great physician. So I think the combination is what makes you what you are today, and why they ask you to speak all over the world on these topics, because you get it. And, you know, as consultants, we're often talking to practices about incentivizing and bonuses, you know, and, you know, a new year is coming. And so some new things need to always come out. And you started a little bit earlier, which is great, with adding some new profit centers to your menu. And you're always on top of like, what's the next thing? What's next? And I think everybody probably appreciates that. We did get a question just now for you, and they're asking if you're doing pellets. And if not, what is your hormone delivery that you are using?
Well, we do all sorts, because not, you know, one size fits all. We actually, we do pellets. which I happen to love. I think they're a great delivery system, steady state delivery system of hormones. Women don't have to think about taking a pill or coming in, once a month for injection, but not everybody wants that, doesn't fit their lifestyle.
Right.
We offer everything from bioidentical hormone replacement in different forms, all the way to pellets. So and plus we're doing a lot of testing when it comes to other deficits they might have for supplements, and adding that to their regimen as well.
So when you say testing, are those blood tests that somebody comes in, or you write a script and they go to Quest or one of the labs?
No, we do it all in-house. Some of the labs we send out, like especially for food sensitivities, we are sending out to another lab. We're also looking at genetic markers for particular medications people might be on. We're doing some saliva testing, especially when it comes down to cortisol levels. And then we base what we find, and we do extensive thyroid testing too, and we do that in-house. But we're basing what we find and trying to fit what they need to their lifestyle.
Have you put together, it sounds to me like a wonderful lifestyle type health wellness program. Do you have one full 360 program in place, or everything right now is just individual?
I mean, I think it has to be individual, and we can generalize a lot of things that people want. But you really have to listen to the patient. You have to do some testing. You have to get to know them as a personality to find out what they need. And it's not like, okay, this is it and it's going to work. It's not a cookbook. So you really have to play with it sometimes. And I tell patients, we might not get it right the first time. So it's, and sometimes it takes 2 or 3 times to figure out actually what to do and what to give them.
Yeah, and that makes sense, because they used to have, I guess they have to have blood tests every 6 weeks or 6 months. I don't know, whatever the protocol would be.
Well, it depends on what they're getting. Usually testosterone patients, once we establish them on a dose, maybe once a year, we look at their levels and some other blood levels of not hormones, but like blood count and all that. So once a year is what my preference is. If once we get them stabilized on what their dose is, up to then it's usually every 6 months.
And, I'm assuming that, people have money, but there's a lot of people who can't afford all of these services. They want to do aesthetic laser and injectable packages. Then they're interested in vaginal rejuvenation, and so how do you handle patient financing options when somebody really can't afford it? Or do you mention, I'll mention Care Credit as one, but do you recommend that, or do your staff recommend that up front, or they wait for somebody to say, I can't really afford this, and then they bring it up?
Well, a lot of times patients will come right out and ask you, do you have a payment plan? So that's when we recommend Care Credit. But, a lot of them, are willing to put it down on their credit card and things like that. So.
Yeah, some people can, and then others can't. So that's where, especially if it's 0% financing, or there's some COVID special, then the 0% financing comes in very handy. We have some practices that mention it up front before somebody mentions it. And then we have other practices, that wait to see if somebody can afford it. I guess it's a matter. So you use it on both sides of your practice, your GYN as well as.
Right. We have it on both sides. We also have a little sign at both check-in desks that state that, we do use Care Credit.
Which is great. And, just having an option to make things affordable to everybody, especially in these times,
right.
I think is wonderful. So I guess, not to keep you much longer, because I know you are busy, but, what are the takeaways, I guess, from this that somebody could really take away and start in their practice? I know that we have the 50 Shades of the Graying Vagina, and you are the author of that, and proud to have been part of your Thermiva programs at that time. And we also have a survey at the end that we ask people questions. More questions will come in, and we'll send them over to you. And at the end, they'll get a link to this webinar, as well as be able to share it and get the handout. But what is your takeaway today when you talk about educating physicians that are not as up on everything. I mean, you're always in courses, you're always training. You're unusual. I mean, more than the usual. I think, I think you're, one of those forever students, which I give you a lot of credit for. So tell me, what is the takeaway for today that you would say for best practices?
Well, I think you kind of have to, I mean, I'm a big promoter of living in the present, but sometimes you have to live in the future. And the future for medicine and for physicians that don't want to be burned out, but really want to help their patients, you have to look what's happening with healthcare and design things in your own practice. Start out small. That was the big mistake that I was like trying really hard at first. I think I had to institute like 3 or 4 different things at once. You have to start out with one project that will make you happy and a service to make your patients happy, and add that. And then you can start adding another one after you get that off the ground. But hiring your staff, one of the biggest things I can say is hire for personality, don't hire for skills. I mean, of course they need to read and write, but you want personality, because if you have somebody at the front desk or a nurse that's helping your patients doesn't have a personality, they're not engaging. My MA is great. What she's doing is she's in there recommending testing for patients and suggesting that they might want to try this. And she knows that she's learned from what we're doing. So she's been educated and she's enthusiastic. So personality and starting out small, if you're going to be adding like cash only services, and then getting education, educate yourself on more than just what your specialty is. And that's why I went back to do the fellowship, because I was tired of patients being blown off by their physicians as far as when it came to their health. Like, oh, you're pre-diabetic, so we're going to watch it. In the meantime, they don't tell them how to eat or what their diet should be. So you've got to start at the root of people's problems and prevent it from happening, as opposed to just slapping a Band-Aid or a medication on it. So that's why I went back to school, to learn more how to serve my patients. And that's opened up a whole new world of diet recommendations, peptides, fasting mimicking diets, and nutritional counseling.
I honestly think, and we should talk about this and maybe do another webinar, but you really should be training other OBGYNs, because what you have and what you've developed, if we can create that into a 360 turnkey type program, that would be so valuable, because we talk to practices all the time, whether it's a med spa, again, any type of specialty, including GYN. And they either have one part of it, the other part of it. They don't really have the whole thing organized and orchestrated. And I think some sort of turnkey blueprint program would be wonderful. And I'd love to be part of something like that with you.
Because that's a great idea. Because I remember early on, when we were instituting vaginal rejuvenation in the office, probably 8 or 9 years ago, I did a lot of speaking around the country to other GYNs. And it was almost like I was speaking to a hostile group. They were so resistant to this idea that could be possible. And that's why dermatology took over that specialty. So sometimes it's hard to get, if they maybe had a blueprint, like you're saying, I think it could work.
Yeah. And as you said, you take little steps, or every quarter you add something new. And it is hard. You go to a trade show. Well, when we used to go anyway, you would get overwhelmed by all the equipment, by all the products. And it's not you, but I'm saying in general. And even for myself, and I'm on top of it, it's hard to be on top of it, because every other trade show, which was every other week, there were new products, there were new lasers, there were new equipment, new services. So really, you had to really do your homework. And I know that you were one who did your homework. I mean, because we, met at trade shows, we went to seminars together. We asked a lot of questions, because there's so many expenses, and nothing is inexpensive anymore. So when you make a decision to buy a piece of equipment or to buy into a product line, it has to be something that you really believe in, and you have to believe in the science. And then you have to decide, do you buy it outright? Do you lease it? And there's lots of options now, more than there were even years ago. But I
Right.
think, you're in the right direction for sure, and you have been. And I think that you training other doctors as you've been trained by other doctors for other specialties, I think would be something that would be great. And I think we even talked about this many years ago.
We did. We
And I
did.
think it's finally almost that time that we really need to revamp that and talk about some turnkey program, especially for GYNs who really are not making a lot of money. And unless they do the healthcare retail, have care credit, offer patient financing, be able to offer other services other than insurance-based services, they're going to be a dying breed sooner or later.
And I think too, they could be making money, but they're this close to burning themselves out because they're working harder and not smarter. And unfortunately, that I found myself on that bandwagon, long time ago. I mean, I was working like crazy, and I had to, I stopped doing OB, not because everybody says, "Oh, you were tired of the night call," because I was burned out.
Yeah.
And I really wanted to focus more on the other end of women's healthcare. And so that's kind of how that came about. But then, you have to figure out, well, I don't want to be working that hard just to make, more money. How can I help patients work, feel better, look better about themselves, and de-stress myself at the same time? So that's how that came about.
No, and I think that, the balancing, not of somebody else's hormones, or balancing your life and your hormones are just as important. And that is a discussion, to have, because other doctors are really stretched and stressed out, especially now with the pandemic. But I know you and I can go on forever. And it's so wonderful to see you. And I toast you all of the time, think about you all the time. And I look forward to having you on as a guest again and exploring some future in GYN aesthetics. I thank you.
I can't wait. And we'll do it soon, and we'll work on our blueprint. Okay.
All right. Sounds great to me. I mean, I'm excited about it. Just came up as we're talking, and I'm saying, I think we're ready.
Yeah.
I think we're getting ready.
That's
Thank
great.
you so much. Thank you so much for your time. And I know that it's been great. And so we have a lot of others save the dates. So maybe some of them even want to join us in on. And we have saved the dates with a skincare and retail expert, and also retail products and building a lasting brand. We have somebody that we've been working with for many years. And the value of financing is such a big thing right now, and building a relationship with one of the companies, which a lot of people miss that mark. So Glenn Holden on Monday, December 14th, we were able to get and squeeze him in December. And I'm so excited that he'll join us. And Hot Topics in Cosmetic Dermatology, one of the best and the finest in the industry, beyond a key opinion leader internationally, is David Goldberg. And he's actually one of the dermatologists that I actually started with probably 25 years ago, opening up a skincare center for in New Jersey. So I'm so excited to have such a great, list of people that will be joining us. Save the dates, open discussions, questions and answers. We have some other questions today. I will get them to Susan. Please join us. Check in at beautifulforever.com and Beautiful Forever University for our ongoing education. All of it is free. We're working on a mentoring program. If you're listening or you know somebody who needs to be mentored, have them get in touch with me. The next slide might have my information, but if it doesn't, it's Cheryl at beautifulforever.com. And we have specials on our digital version of the book, Beautifully Profitable. And we have 50% off the digital version. So you can use the discount code on beautifulforever.com. It's not good on Amazon, but you can use it for the digital version, and you can use the VIP as well, the Profit actually, PROFIT, which we all want. And I'm happy to do complimentary sessions for any of you out there to expand your centers, to look into 2021 and help you grow your practice. And public relations should be part of an effective way for lead generation. So think about that, and look forward to hearing all of your comments and questions, and they're always welcome.